Hello everyone, welcome to sqadia.com. Today the topic of our lecture is the disorders of the childhood and adolescence, and of course we are discussing the psychiatric disorders which are related to this age group specifically. We'll be talking about the children under 5 specifically because that is quite a problematic age group, and then the adolescent age group is again discussed quite in detail over here. The sections basically encompasses, first of all, the primary section. The first section is the mental health disorders. First of all, we'll be defining these mental health disorders. How do we go about the different terminologies that are used when we are dealing with patients who are suffering from any psychiatric illness and they are in the age group of under 5, or even they can be in their adolescent age group, that is almost the teenage group that we are usually concerned about. So the causes will be discussed over here, and obviously the causes ranges from the environmental factors as well as the primary factors of the child himself. For example, the neurodevelopmental disorders and the environment and the familial environment is again very important over here. Genetics play their role quite importantly over here, and so we will be discussing them in detail over here as well. We'll be considering the factors that are quite important to keep in mind when you're dealing with such patients over here in this section. In the second section, we'll be discussing the very important cause that is brought up to the doctors, that is the sleep problems. The nightmares is the primary problems that is involved over here, and then there is a terminology which is used and which is known as the night terrors. How do we go about defining this terminology? What are the causes to this terminology, and how do we go about to manage such cases of night terrors as well as sleepwalking, which is another phenomena quite commonly seen. Then the feeding problems is another quite a major group of psychiatric disorders. Sometimes it is a normal fadding process through which the child is going through, and sometimes it is an abnormal feeding or weaning process that is going on. So we should know how to identify and distinguish between these two criteria. In the third section, we'll be discussing the child behavioral disorders over here. The oppositional defiance disorder. So it's another quite common disorder that the parents and the clinicians go through, and they should know how to identify this disorder and how to manage such cases. Sometimes the conduct of the child is not in an appropriate manner. It's not in an age-related manner. So that can also be included over here. The treatment and exceptions along with these treatment guidelines will be discussed over here whenever we have problems with the conduct and the overall behavior of a child. In the fourth section, we'll be discussing the attention deficit hyperactivity syndrome, which is also abbreviated as ADHD. How do we define this condition, and what is the spectrum of disorders that comes under the definition of ADHD? That's again very important. What are the clinical presentations that is going to be helpful to identify such children, and how do we manage such cases of ADHD will be discussed over here in this fourth section. In the fifth and in the final section, we'll be discussing the autistic spectrum disorder, abbreviated as ASD and commonly known as autism. So we'll be discussing the definition first of all, and along with that, we'll be going through the risk factors that cause or that result in the autism or the autistic spectrum disorder. Then we'll be discussing the clinical features, and along with that, the management or the guidelines to the treatment of this autism. So I hope you want to learn more about these childhood and adolescent disorders. So do watch the other sections to this lecture as well.